up here. So our next speaker is Dr. John Dahunsi. He's a psychiatric health professional in the Office of Occupational Medicine and Nursing and the Directorate of Technical Support and Emergency Medicine at OSHA. He will be presenting mental health and suicide prevention in the oil and gas extraction industry. And I will turn it over to him. John, if you would like to share your slides.
Yes, it won't allow me to share until someone has stopped sharing.
Oh, all right, let me see. How's that?
Let me just see. Just share. Sorry, I can't see the top bar. Okay, there we go. Okay.
Perfect.
Hey, good afternoon. My name is John Dahunsi. I'm a psychiatric mental health nurse practitioner with the Occupational Safety and Health Administration. This presentation today will focus on mental health and suicide prevention with an emphasis on the oil and gas extraction industry workforce. The objectives that will be covered today include reviewing statistics regarding mental health disorders and suicide most prevalent in the United States workforce, identifying psychosocial stressors experienced by oil and gas industry workers, providing guidance regarding tools to support and mitigate mental health symptoms among oil and gas extraction industry workers, practicing to help foster honest and meaningful conversations with coworkers as well as employees. And finally, discussing helpful resources and how industry leaders can use them to effectively address employee mental health needs. So what is mental health? Mental health encompasses our social, psychological, and emotional well-being and is a vital component of our overall wellness. Social health is the extent to which we create meaningful interpersonal connections and relationships. Psychological health pertains to how we internalize and evaluate experiences throughout our life, while emotional health is the extent to which individuals react and express outwardly, both verbally and non-verbally. Mental health can affect many facets of our life. It affects how we think, how we feel, how we act, and helps determine how we handle stress, which can be especially true in a workplace setting. So what does it affect? Our mental health can be affected by two avenues. One is managed experiences such as death, divorce, social isolation, and job-related stress. The second are genetic predispositions passed down from blood relatives. So how do you know that it's a time-limited difficult experience versus a true mental health disorder? The current Diagnostic and Statistical Manual for Mental Health Disorders states to be considered a disorder, it must negatively impact an individual across multiple settings, which may include personal, social, as well as occupational. The mental health disorders most prevalent in the United States workforce include mood disorders, major depressive disorder, anxiety-related disorders, generalized anxiety disorder, stress-related disorders, which include acute as well as post-traumatic stress disorder, and substance use disorders, which include alcohol use disorder and opioid use disorder. So data from the CDC reports that deaths from suicide ranked as the 12th leading cause of death for people of all ages in 2020. Approximately 45,979 people died by suicide in the United States. That is one death every 11 minutes. In individuals aged 35 to 54, suicide is ranked as the 5th leading cause of death. This age range is significant because the average age of oil and gas extraction industry workers is between the ages of 35 and 54. Currently, the CDC groups mining, quarrying, and oil and gas extraction workers in the same industry. This industry had the highest rate of suicide out of all other industries, with nearly double the rate in 2019, with 54.2 versus 27.4 per 100,000. So research and literature tell us that there is no one single cause for suicide or the development of mental health disorders. However, there are factors that may increase the risk. Some of these factors include biological factors, such as genetic predispositions and biological changes of the body. Psychological factors, which may include abuse, trauma, neglect, discrimination, and self-esteem. Clinical factors, which include seeking help when needed and the availability or access to treatment. Social factors, including social economic status, education, employment, and social supports. And environmental factors, which may include substance use, lack of access to resources, or adequate housing and basic needs. It is important to note that not all risk factors are modifiable, but in this industry, strategies implemented to address psychosocial stressors can influence many of these factors. According to the CDC, in 2021, the oil and gas extraction industry employed around 126,000 Americans. Male employment in this industry is 76.6%, which presents additional factors for consideration, because studies report that men are more likely to complete suicide at a rate of 75%, but are less likely to seek help for mental health concerns. So what are some of these psychosocial stresses that may influence increased mental health concerns and suicide risk in this industry? Psychosocial stressors may be difficult to detect and describe. Work stress in the oil and gas industry can involve many factors, such as communication between employees, conflicts between employees and supervisors, shift work, which may include long work hours, such as 12-hour shifts, long work weeks, and physical and emotional exhaustion due to the challenging nature of the work. Ultimately, stressful work can lead to burnout. Cognitive demands place employees at a greater risk for work-related stressors. For example, drillers are employees who have a high cognitive demand to perform their duties, as they are responsible for the day-to-day operations that occur on the rig. The work environment in this industry can also be a factor to consider, as some work environments are remote, and which require employees to spend several days or weeks away from their family. In some instances, there are camps set up for employees to spend their off hours, which presents its own challenges, such as social isolation, as well as increased risk for anxiety. Fatigue is an extensive psychosocial factor in this industry and is reported to cost more than $18 billion in lost productivity alone. Fatigue can have detrimental effects in this industry, such as the BP Texas City incident of 2005, which resulted in 15 deaths, 180 injuries, and a financial loss of at least $1.5 billion. In the analysis of this incident, fatigue was identified as a contributing factor, as some workers had been working 12-hour shifts for as many as 29 consecutive days. So many of these psychosocial stressors occur simultaneously, and thus it increases the overall psychosocial stress an employee may experience. So addressing mental health and suicide prevention in this industry can be a complex task, which requires employers and industry leaders to have a level of awareness and sensitivity about these topics. So the big question is, how do we go about making long-lasting change to decrease these rates in the future? So I've broken down our approach into three main phases: normalizing, understanding, and asking; educating, providing support and resources; and partnerships and preventative measures. So to understand the concerns and needs of workers in the oil and gas extraction industry, informal discussions with employees to bring awareness to the issue while using appropriate conversation is imperative. In phase one, strategies to consider include normalizing mental health conversations and addressing masculine stigma. as well as understanding the positive impacts of knowledge of mental health. It's important to understand your role as well as asking the hard questions. So the first step is normalizing conversations about mental health and suicide risk, which helps to create a safe place for coworkers and employees who are suffering in silence or who may be afraid to reach out for assistance. Nonverbal communication is going to be just as important as verbal communication, as it helps to increase trust as well as clarity. In this male-dominated industry, males may tend not to seek treatment, possibly due to stigma of cultural masculine norms that discourage emotional expression and view seeking help as a sign of weakness. The goal would be to address the stigma by having authentic conversations, building social cohesion in this subgroup, and empowering employees and coworkers to reach out to other individuals who may be struggling before it's too late. It's important to pay attention to noticeable changes in a person's behavior, such as them not responding to text messages or phone calls. They may appear tired or distant, or they may appear more sad or irritable. Positive mental health. Bringing awareness to mental health and suicide prevention in this industry can help to bring many positive factors to light. Many individuals suffer in silence because there may be a belief that it's only happening to me. As topics about mental health and suicide continue to be discussed, employees may feel more comfortable utilizing positive coping strategies and resources to address their mental health concerns. This will then lead to increased work productivity as well as meaningful contributions to this industry. So as a coworker, supervisor, or industry leader of someone who is dealing with a mental health concern or who may be at risk for suicide, it's important to know how to support that person. It's important to be there to listen to the individual without judgment and offer support and also provide them with resources to get help. Remember that you can always provide empathy without trying to fix the problem. So here's some key language that can assist you in having these tough conversations with employees, coworkers, as well as some language to stay away from. So some of the stigmatizing language includes, there's always someone who's worse off than you, or identifying an individual by their disorder, such as he's schizophrenic, she's schizophrenic, he's bipolar, she's bipolar. Instead, using terminology such as he has bipolar disorder, or he suffers from schizophrenia. Other stigmatizing language, again, you need to snap out of it, or I know how you feel. And then the non-stigmatizing language also provides that support that a person may need, such as I'm here for you. You're important to me. Let me know if you need to talk. Come talk to me anytime. When encountering a person who may be at risk for suicide, which we have identified as being the highest in the oil and gas extraction industry, it's important to not avoid asking the difficult questions, because this may be the difference between somebody getting the help that they need versus an actual attempt. So ask directly about suicide. Are you having suicidal thoughts? Are you thinking about hurting yourself? If an affirmative response is given, the individual should not be left alone and be directed to the appropriate resources. Now that we have discussed normalizing and awareness of mental health and suicide risk in this industry, we're going to discuss the implementation of phase 2. Implementation of phase 2 would include providing education related to mental health and suicide prevention and providing ongoing support and resources. Industry leaders can be successful in the education aspect of phase 2 by generating emails just discussing the importance of mental health and suicide prevention awareness. Continuing to provide awareness to the topic Industry leaders can also incorporate mental health and suicide prevention topics into company newsletters, highlighting national weeks dedicated towards mental health awareness, which usually occurs in the month of May, as well as suicide prevention, which usually occurs in the month of September. Including mental health and suicide prevention into monthly meetings can also be a very effective way to increase awareness. Displaying suicide prevention posters with resources in areas where employees assemble can also help to increase access to resources in a discreet manner. So it's important to familiarize yourself with the resources for mental health disorders and suicide prevention, such as 911, the Suicide and Crisis Lifeline, the Employee Assistance Program, mental health professionals, 311 for local services, telepsychiatry, and mobile crisis teams. If there is an imminent risk or immediate danger, 911 should also always be utilized. But it's important to understand that some employees or workers in the oil and gas extraction industry may not have immediate access to 911 services due to the remote locations of the worksite. So it's important for coworkers and supervisors to serve as that first line of support for that worker if they have a mental health concern or are showing changes in behavior, or maybe even present as a suicide risk. So I did want to take a moment to highlight the Employee Assistance Program as a resource, because depending on the company, there may be different levels of services that are available to help address many of the psychosocial issues that could affect workplace performance as well as lead to mental health concerns. So phase 3 would then engage local organizations as well as mental health professionals to provide discussions, webinars, and presentations about mental health. The goal would be to foster a culture that promotes a mentally healthy work environment. Introduction of preventative measures into the workplace policies, such as including mental health and suicide prevention education and awareness in the orientation or in the new hire process, helps to create a culture of priority as it pertains to mental health and suicide risk. Other preventative measures may include generating focus groups to discuss psychosocial job-related stressors of frontline workers. And this may also generate or identify additional factors to consider. So I have a scenario which will help show how to support an employee who may be in need. So you work with Max, an employee who has been flying in and out of a remote work site for the past 2 years. Max spends about 2 weeks at a time on site. Recently, Max has been showing up for his duty station late. He has seemed a little more fatigued, his clothes are often messy, and he is often found hiding out in the bathroom or staring into space. Other workers tell you Max is having relationship issues at home with his spouse. You confront Max about his recent performance, and his response is, "I just don't care about anything anymore." So here are some tips for responding in the moment. By making this statement, Max has provided you with the opportunity to respond. So how you react is going to be very important. Taking all thoughts of suicide or depression, in this instance, serious. Do not dismiss Max's thoughts as attention-seeking or a cry for help. So what are some things you could say? So it's going to be important to stick to the facts when responding. Do not attempt to add feelings or your own personal biases. State what has concerned you about Max's recent changes. Remember, your nonverbal body language is going to speak just as loudly as your verbal language. Speak with Max in a private setting to help maintain confidentiality. Use a calming tone and possibly respond with something like, "I hear you when you say you don't care about anything anymore. I've also noticed some changes in your demeanor at work. I want you to know that I am here for you." If Max does respond, it's important to listen without interrupting or expressing judgment. Then reflect what Max has said, summarizing it in your own words to show that you're listening. The next step would be to provide Max with further resources. And these are my references here. And are there any questions? And I've also included my email if anybody has any questions that they would like to ask. And I guess I should have introduced myself a little better. So my background, again, is as a mental health nurse practitioner. I have a doctorate in mental health, and I also specialize in substance use disorders as well.
Thank you so much. Do we have any questions?
Oh, I do see a
So,
question in
I just
the
saw that.
chat box in regards to suicide rates. So I didn't pull the literature in regards to the international rates. I kind of just focus on the US population for this presentation.
All right, any other questions? All right, so we are right on time then for our second break. We'll be keeping the slide set going during this break. And we will continue again in 5 minutes at about, well, actually it gives you just a little bit more time, 7 minutes at 2:45.